From rich farmland to a well-renowned military base, Christian County is home to a diverse population of over 74,000 residents, consisting of various ethnicities as well as a large military, Amish, and Mennonite population. Our vision at the Christian County Health Department is to take a lead role within our community, to seek out health issues and health disparities, to sustain and improve the well-being of our environment and our citizens. My name is Amanda Bassingthwaite, and I'm the marketing specialist here at the Christian County Health Department. I've been here for about 5 years, and I've had the pleasure of promoting our health department services in the community. And when we talk about our health department services, it can range from flu shots all the way to septic tank inspections. We do a lot of things that the community is unaware of. But all of our programs can be encompassed into our 3 main departments, and that's our clinical department, our health education department, and our environmental preparedness department.
My name is Tara Hart. I'm a registered nurse. I have been with the Christian County Health Department and in public health for 7 years. So with the clinical services that we offer, we see the itty bitty babies from birth all the way up until the elderly with, vision screenings or with cancer screenings for women. So we see a whole wide array of age groups. We lay the foundation of having a healthy nutrition for their life. Either if they're breastfeeding or formula, making sure that the parents know exactly what the child needs to eat and, what are good, healthy lifestyles and choices that they need to make. Another area is vaccination. So we want to make sure that those kids are getting in and getting their vaccines so they aren't getting these illnesses later in life and that they are vaccinated. So a service that we do in the clinic that might be surprising to people is lead tests. And with that, we target usually 1 and 2 year olds because in Christian County, there are homes that were built before 1978 and they could have lead pipes, they could have paint that had lead in that when it was built. So we want to make sure that we screen those children to make sure that they have safe levels and that they don't have any lead in their body. So most of the time we're in the clinic seeing patients, but we do occasionally get out and see community members, and we do TB skin tests. We also do flu vaccines, and then most recently we've been able to do hepatitis A vaccines for community members.
My name is Amanda Scholler. I'm a women's health nurse practitioner. I've been here at Christian County Health Department for 20 years. I work in the clinic, but specifically I'm in charge of the women's health program here at the health department, and I also do the STI clinic as well. Family planning is one of the main things we like to focus on here at the health department. We see a range of women anywhere from adolescent to postpartum. Here at the health department we have many varieties of birth control that we can offer women so that they can be in charge of their family planning. It's so nice to be able to be in charge of that and to make decisions and to be empowered to know when you're ready to have a family. And we have many devices here at the health department in which we can help you make those choices for what's best for you at this stage of your life. We have all the latest birth control methods here at the health department. Of course, we offer the birth control pill, the Depo-Provera injections, NuvaRings, birth control patches. We also insert the LARCs, which are the long-acting reversible contraception for women who don't want children for several years but still want to keep their fertility options open. So we have the Mirena IUD, we have the Paragard IUD, Kyleena, Skyla, as well as the Nexplanon. So pretty much any of the latest methods of birth control that you've read about or seen about on television or magazines, we can offer those to you through the health department. Here at the Christian County Health Department, we also have the Women's Cancer Screening Program, and it's for women all ages, but in particular those that are ages 40 and above who may or may not have insurance or be underinsured. We offer cancer screening exams where you get your whole GYN physical, including your clinical breast exam, pap smear if needed, and we can help you even pay for the cost of a mammogram. We schedule those for you and we can help pay for those based upon your income. So just because you don't have insurance or a medical card does not mean that you cannot be seen here. We can see you and we will work with you on those costs for those types of exams. We also see women ages 21 and up for pap smears when needed, and as well as clinical breast exams. So those are things that we do offer here at the health department. It's a good screening tool. We need to be in control of our health. You know, cervical cancer and breast cancer are things, if we find them, we can fix them. And so we want to make sure all women have this opportunity available for them and to know that they can come here to receive those services. Here at the Christian County Health Department, we do like to focus on prevention of disease and illness and infection. My role in prevention would be through the cancer screening program, the annual pap smears. We can do those to detect any abnormalities that could turn into cancer someday. If we find those abnormalities early, we can fix those. So that's a good form of prevention. Another form of prevention is unplanned pregnancy. You know, we like to see our patients here before they become sexually active so that we can have them prepared and talk about all the options available to them. So that's also a form of prevention. Another form of prevention that I like to include in my practice is prevention of sexually transmitted infections. We like to educate our patients here in Christian County on the infections that are out there and what can be done to decrease your risk of contracting any one of these infections. Here in Christian County, unfortunately, we have seen an increase in the number of our sexually transmitted infections in our county. Unfortunately, we have one of the higher rates for chlamydia and gonorrhea in the state of Kentucky. These are both totally preventable infections if people will use safe sex practices and limit the number of sex partners and use protection. So we really like to educate our patients on how to prevent, contracting one of these infections. We have also seen an increase in syphilis in our county. Syphilis, again, is an infection that's transmitted sexually. Often you don't have symptoms. You don't know that you have this infection. So it's so important, if you're participating in any factors that could be risky, that you please come in and receive a routine screening for those types of infections. We still see HIV cases here in Christian County as well. So we like to talk to our patients about prevention, how to prevent, catching HIV and syphilis and these other things. These are all totally preventable, and we just want to make our public aware of what they can do to protect themselves.
My name is Kelly Howell, and I've been in public health for about 4 years now. I came to public health from the education field. My passion is teaching others, and I thought that I would love to be able to teach others how being healthy definitely impacts all areas of your life. So health education is definitely taking a preventative stance to health care. We like to get out and talk to people about how being healthy and making small changes in your life can definitely keep some of those chronic diseases from setting in or ever playing a part in your life. And we find that that saves people a lot of money in the medical side of things, as well as just letting them live healthier and happy lives. Health education is comprised of 3 health educators that go into the community, and we present on different programming. Some of our programs are things like Freedom from Smoking, which is a tobacco cessation class. We also have things like Germ Busters, where we go into the schools and also for teenagers and adults about how to wash your hands to make sure that you're not spreading any of those germs that like to give us the flu and the colds and all of those unhealthy things. We also do programming like sex education and binge drinking, which can sometimes be a difficult subject to talk about, but it's definitely needed in addressing the health of the whole person. Sex education is definitely a difficult topic to talk about sometimes with students and as well as parents talking to their own children. Research shows that parents are the best educators that teenagers do have in their lives. So although it may be difficult to talk about things like sex education and risky behaviors, that's definitely something that we like to get out and talk to parents about, as well as talk to teenagers about. We just talk to teenagers about how to protect themselves from the risk, as well as that abstinence is definitely the best choice as far as protecting your sexual health too. Health education, we like to go out and talk to everyone from the toddlers and the daycares and the preschools through the elementary, middle, and high schools. Our school system is a great partner that we have. We also like to talk to adults through their work sites, through different community hobbies that they may have. And then finally, we also talk to senior adults. We love to go out and present educational programs to our senior adults as well. Health education isn't just here at the health department. We get out into the community and we have lots of community initiatives that we've taken part in. One of those was the Run for Your Buns 5K. We participated and hosted that a few years ago. One of the most successful programs that we have hosted in the past several years has been the 100 Mile Challenge. With the 100 Mile Challenge, participants are encouraged to walk about 100 miles in a couple months. We have seen over 1,000 participants in this program, so it's been very successful in our community. One of our most successful programs that we've had in health education is our tobacco cessation programming. The tobacco cessation programming is to help individuals and encourage them to quit using all tobacco products. In fact, it's been so successful that our smoking rates in 2012 in Christian County was about 36% of the population used tobacco products. Now, with our most recent health rankings, we've seen that drop to only 26% of our population that uses tobacco products.
My name is Jill Harton. I've been in public health for 11 years now. I work in the environmental preparedness department, mainly dealing with preparedness. For example, if there was ever an event like a bioterrorism event, like anthrax was spread throughout the community, we would go to our pods. We have 4 different pods set up throughout the community, and that stands for Point of Dispensing. There we would get the entire population of Christian County through within 48 hours, so we could administer either the vaccines if needed or medications to take home to give to your family. And we practice this. We'll set up flu clinics. Even our rabies clinic are modeled after one of our pod sites, just so we can practice getting people through quickly and see if there's anything that we need to change. During the eclipse, we played a big role. We met quarterly and then monthly and then weekly up to the eclipse, just planning with local agencies to make sure people could get out if needed, to make sure there were safety stations around, medical stations set up. We were afraid the roads were going to be jammed, so we made sure that there was a medical station set up at the greatest point of eclipse.
I work in the environmental department. The environmental department is responsible for multiple inspections throughout the community. We take care of restaurant inspection, hotel motel inspections, RV parks, tattoo studios, public swimming pools, and we also are responsible for the private septic systems that are installed into homes out in the county. One of the things we do that I think surprises most of the public is that we are involved with animal bites. If a domesticated or wild animal bites someone, we are required to either quarantine that animal or have the animal submitted for testing. So a lot of folks don't really know that we do that. Or they've got a misconception of what we do. They believe that if their dog has bitten somebody, we're going to come take their animal and have it destroyed, which is something we just do not do.
Every 4 years, the Christian County Health Department conducts what we call the Community Health Assessment and Community Health Assessment Improvement Plan. And often when you hear us talk about this, we'll call it the CHA and the CHIP. But it's a very important assessment that we do to assess, one, the health of the community. And when we send out these surveys, it's a very comprehensive survey we send to the public, but we also talk to the city and get satisfaction surveys from the city. We look at health data from the CDC as well as community health rankings, and we get a coalition together, which is called our Christian County Wellness Coalition. It's comprised of a wide variety of partners, including the hospital, law enforcement, school supervisors, superintendents. We get everyone together and we assess all of the data and we find out where is the mud and the dirt in the community. And we figure out where the problem is, and then we build a plan. How do we address these issues? And so every 4 years we take a look at this as a community, but then as a health department we look at these plans and we adapt our programming to facilitate the needs in the community and to better the health of the community. This community health survey we send out for the community health assessment is a vital part of our decision-making process here at the health department. So we always encourage community members to please fill this out because your voice can be heard during this assessment. Whenever we get all of this data back, this is the information that we look at to see what the needs are in the community at ground level. We're not just looking at national statistics. We want to hear from you as the community. So we always really encourage individuals out there, when the process comes, we advertise for that and really encourage you to fill out that survey so that we can hear your voice and your health concerns. At the Christian County Health Department, we talk about all of the services that go out into the community, but we also have departments in-house that serve a vital role to ensure that the health department runs smoothly. We've got our accounting department that takes up all of the money and bills the insurance for patients. You've got your IT department, and that's the department that keeps all of our electronics running like they need to so we can serve the community. Our human resources department ensures all of our employees are safe and doing their best to promote these services and serving the community. You've got your marketing department, and we're the ones who market all of our programs in the community so that the community knows what's going on, whether it be through Facebook, through the radio, through media campaigns. And another vital role here at the health department is that of our executive director. Our director is the one that plays the liaison between the community health department and the state. We're what we call a quasi-governmental agency, so we're governed by a local board of health and we have our own autonomy, but we also have guidelines set by the state that we have to follow. So she plays the liaison between the two, and she's the one that advocates on our behalf and advocates for community initiatives. She's the one you're going to see up with legislation. She keeps up with all the new bills and laws that come into play. And our community health directors are the ones that, again, play that liaison role between the two departments. So who are we as a health department? We are a team of staff dedicated to promoting and preserving the health of our community. Whether it be through our clinical services, health education, or through our environmental preparedness department, we are here to lead the community and change the public's health one person at a time.